As the pandemic has progressed, we've been listening to the questions you have about the data, especially COVID-19 numbers and how they're reported. Thanks for joining us tonight. I'm Rolly Hoyt.
And I'm Marlisa Goldsmith. THV11's Ian Russell took those questions directly to the experts to learn how the Department of Health reports those numbers we see each day.
Some of you have been sending us questions recently about the way the state reports COVID numbers. So we're breaking down how those numbers are reported and how simple the process has become over the last year and a half. Let's start with reporting. The State Department of Health says there's really only 4 steps in total when it comes to positive tests, ICU capacity, and hospitalization. So step 1, someone takes a COVID-19 test at somewhere like a testing site or a hospital. The second step, those actual results. If you test negative, it stops there, but if you test positive, it's on to step 3, reporting those results to ADH. The results get there one of 2 ways, either through electronic lab recording that hospitals like UAMS use. If clinics or hospitals can't use that system, they go old school by just faxing those numbers over. Once ADH has those numbers, then it's that final step, reporting them. From start to finish, this whole process can take anywhere from 1 day up to 3 days. For ADH, reporting COVID-19 is more simple than ever.
We've gotten pretty good, after 18 months of going through this pandemic of, really expediting and making our processes more efficient.
For something that seems so simple, ADH tells us their team is working to make sure all Arkansans know what's happening.
We have put in countless hours every day, literally, even on holidays, to make sure that the people of Arkansas and the stakeholders have this information.
When it comes to questions over the legitimacy of positive tests, ICU capacity, and hospitalization numbers, there's no reason for small clinics or the big hospitals like UAMS to fudge the data.
There's no benefit to us or to anybody else in over or underreporting the numbers.
Dr. Porter says he understands people's questions and concerns about the numbers. There are a lot that are reported each day. But he says we should keep in mind, they've got the experience to make sure this is accurate and correct.
Well-trained experts, epidemiologists, data analysts who are working around the clock to make sure that this process is as smooth as possible and to make sure that our data quality is certainly up to par.
Reporting in Little Rock, I'm Ian Russell, THV 11 News.
Ian, thank you. Now, both of those ADH experts also tell us they'll keep reporting these numbers until COVID-19 is no longer a threat in the natural state.